So, leadership programme works alongside that. That's been contracted out to an organisation called Health and Care. And the role of the leaders, again, they're paid 7 hours a week. Their role is about challenge and change, or infiltrate and influence, as I was talking about at the start with. People started getting a bit nervous when I started saying that though. So, challenge and change. Their role is about going along to parish and town council meetings, safer neighbourhood meetings, pact meetings, friends of the practice meetings. It's about going along to any decision-making opportunities to be able to influence the way that services are delivered and developed. And the way that they are qualified to do that is because equally they should be working within the community at lunch clubs, drop-ins, to be able to start that dialogue and that sort of two-way consultation sort of opportunity that informs what it is that they should be saying to the decision makers. Okay? Working alongside the leaders, we've had an evaluation programme in place since day one. We have kept that evaluation programme in place, although we have scaled it right down. The value of that programme started off at 1 full-time worker and a fleet of 20 volunteer evaluators, and we've scaled that down now to the evaluation programme really just providing a small amount of support to the work that I do around monitoring, and they help coordinate an evaluation data steering group. But their role is much less now, but still we see that evaluation is incredibly valuable because quite honestly you can't sell the case unless you've got really good evidence that illustrates how well you're doing, what's working, what isn't. So their role is about capturing the journey. Then last on that list, but as far as I'm concerned, almost the most important part of the programme, not the sexiest bit, but the most important bit, is Community Commissioning Initiative Fund. And we have a pot of money set aside every single year, and we've developed an application and appraisal process, and we invite groups of people to bid in for small amounts of money to be able to develop anything within their community that vaguely links to our vision. So that could be lunch clubs, coffee mornings, table tennis clubs, walking groups, etc., etc. The list goes on. The people could literally be 6 neighbours. It has to be a group of older people. We don't fund just individuals to do anything. They don't have to be registered as a charity or anything like that, but it gets the job done. Now, and I'm going to talk a tiny bit about that in a minute, but just to let you know that we've now funded over 250 projects within the community, and you'll see from the data on how many people are sort of active, what's going on in our programme, what impact that actually has. The community development workers role is simple. I've got, well it's not, it's incredibly complex. They generally work with other professionals to be able to achieve a really good outcome for the programme, as well as supporting the wayfinders and leaders. They too, of course, are very popular because they help to support all of the elements of our programme. The benefits of the programme as a whole are as they're listed on there. Obviously, there are issues relating to rurality. People can't get from A to B because we have poor transport. People don't want to get from A to B, quite honestly. They're quite happy in their own communities. And the resources across Dorset, from one side to the other, are extremely different. Really, really different. We've got very urban areas. We've got a bit around the edges of Bournemouth and Poole that might look into Bournemouth and Poole for shopping and services and things like that. Then, of course, all the people around the edge of the county might be looking outwards to the surrounding counties. So, localisation, very, very important to us, and that is why there are so many wayfinders and leaders, because they're allocated to these local areas. So I can do it. The benefits, in terms of just pure numbers, are that if you were to look at 2009-10, 53,000 contacts with Dorset Pop, for example. So we are talking big numbers. Some of those might have been double counted because they'll have come into a wayfinder, they might have ended up in a local walking route, so they'll have got counted on both sides. but we monitor absolutely everything. 490 outcome stories gathered, and that was in July of last year. We've created, and again, right back at the end of March 2010, there were 599 new volunteer posts created as a result of this programme. Now, most important to us is outcomes. Outcomes are everything. So when we were coming out of the Department of Health funded period, where numbers were more important, we said to Dorset County Council and NHS Dorset and all our key partners, what's really important to you? And everyone came up with the idea that are people better off as a result of this programme is the absolute thing that is top of our minds. So we created 8 desired outcomes. They're all up on this screen, and again, I'm sure that you're going to be able to email around my presentation if people want it. And you're going to, if you come into my workshop this afternoon, which isn't selling, yes, delivered Meals on Wheels, and where we have rural isolation, because that social aspect of eating, as well as nutrition and hydration gained from that, is really important. The other county-wide community savings within a year period, just on 14, of up to £600,000. And again, this afternoon I'll describe a bit more how we've come to that conclusion and what that actually relates to in terms of service delivery and cost savings. But I don't want people to get hung up on the cost saving bit or on the numbers. The important thing to us, again, I must stress, is those outcomes. People are better off as a result of our programme. We've now influenced the agenda of ageing well in Dorset. We were involved in Total Place in a big way down in Dorset. We've nationally influenced the agenda of transforming social care to get it where it is now, which is at the end of its programme. We're also obviously influencing transforming community services, and in Dorset we've got a scheme going called Safe and Independent Living, which I'm not going to go into great detail about, but it's a multi-agency referral process. That's Winterbourne Stickland Table Tennis Club, and our key outcome from this programme, £387.
Thank you very much, Steve.